who tells me wherever he goes, people are asking him about coronavirus already. The MEC for Gauteng, Dr. Bandile Masugu, the Acting Director General, Dr. Anban Pillay. We have a distinguished panel of leaders from various departments, from the NICD and from the laboratory services, NHLS, and a number of other departments, DIRCO. We have the apology from Minister Pando, who we've had quite a bit of discussion about the matters, and she is traveling abroad. We may be also joined by Deputy Minister or maybe some of the officials. You have had all the various leaders within the different branches of health and the NICD acknowledged already. So we want to acknowledge all who are here with us this morning. We thought it's a very important briefing to make, seeing that there's been quite a lot reported about the novel coronavirus. And so as the Department of Health, we just wish to assure the public that South Africa is adequately prepared for active surveillance, early detection, isolation, and case management, contact tracing, and prevention of onward spread of coronavirus infection. And to share full data with the World Health Organization, South Africa has no reported or suspected cases up to date. We do have the apology of the the director for WHO, who is not able to join us personally, but may also be sending some representatives. Research into the epidemiology or a natural history of the virus is ongoing. Although the origin of the disease in Wuhan City, China, is suspected to be zoonotic, that is animal origin, evidence suggests that the current spread is from human to human. According to the WHO, the incubation period is about 2 to 10 days, though some literature has cited up to 14 days. More evidence is needed to determine if asymptomatic patients are contagious, although the preliminary evidence suggests that, like SARS and Ebola, all the contacts reported were patients who had symptoms. Typically, patients present with flu-like symptoms and cough. The disease can be complicated by shortness of breath, multi-organ failure, and death. Most fatalities reported were elderly persons or persons with pre-existing comorbidities, suggesting that these are population groups that are most at risk. Contrary to some of the media reports, there is no evidence that the genotype of the organism is mutating. So the virus still looks the same now as it was first isolated in December last year. The department is aware of the cases that have emerged in countries outside of China and is closely tracking the movement of the virus. The numbers change rapidly, so I may quote something now in order to find that by the time I get to the end of my address, the number has changed so drastically, so I won't even give you any numbers as we speak. But I think all of us are aware of the numbers that keep getting reported, mainly from China. Closer to our shores, we are aware that there's a suspected case under investigation in Zambia. The NICD is closely monitoring that situation. We will shortly invite Professor Cheryl Cohen, from this institute to elaborate in more detail how the institute is tracking the numbers and how it keeps the public and stakeholders informed. You will also have the opportunity to walk through the Emergency Operating Center straight after this briefing, where you will be able to see for yourselves the hard work and the expertise that goes into responding to a disease outbreak that could be potentially pandemic. On the 27th of January, we published travel advice based on WHO recommendations. These take into consideration all factors which determine the level of threat to a particular territory. I may as well pause here to say that we are also on the lookout with detecting some fake news that seem to be distributed in social media as notices coming from the Minister of Health, which is untrue. And so we will be doing our own briefings regularly so that you know the authenticity of the information that you're getting. The guidelines have not recommended any restrictions on travel and trade, but it is recommended that non-essential travel to Wuhan city in Hubei province should be avoided or postponed. Prospective travelers can monitor the situation and plan their travel accordingly. Our understanding is that currently Wuhan city is essentially quarantined and 5 million citizens have been evacuated. Chinese authorities have closed all public transport entering and leaving Wuhan and other areas in Hubei province. South Africa has responded rapidly to ensure that the coronavirus does not become a national threat. As a department, it is standard procedure to monitor emergent outbreaks, and we are currently tracking a plethora of pathogens, including those viruses of pandemic potential like H5N1. We also then wish to reassure that coronavirus is no exception. We're working very carefully to ensure that we track everything around this virus. In the recent past, we've effectively responded to public issues such as the Ebola virus outbreak that is currently ongoing in the Democratic Republic of Congo. And even in this case, we would actually have details of a case detected in Congo even before it lands anywhere close to us here. And for us as well, we have been able to pick up any suspicious cases and screen them and test them and make sure that it is not Ebola, so that there's not a risk that a patient could be wandering around without us being aware of what risk might have been. So we are very, very tight in that kind of management. In regard to the coronavirus, due to the rapidly evolving situation in China, the multi-sectoral national outbreak response team, this is inside this country, was convened on the 24th of January 2020. We call it MINORT. It comprises WHO, national departments such as Home Affairs, Agriculture, International Relations, Tourism, representative of the private health sector, and so those departments that tend to be immediately affected by the nature of the virus that will be detected tend to be the ones that meet, and so we've convened this team regularly. At that particular meeting, the incident management system was set up with the key roles and responsibilities identified and named responsible official attached to each key functional area. So already that team is in place. The current activities already undertaken by the Department of Health and NICD include an alert that was developed and disseminated to all provinces and stakeholders. MINORT and provincial outbreak response teams have also been activated, so our provinces are now on full alert on this matter. Press releases have been circulated and various officials from Department of Health and International Relations have been interacting with the media and the public. Our media analytics have revealed that 284 media citations of coronavirus with estimated reach of over 125 million people between 20th and 26th of January 2020. We're trying to maximize our reach to the public. A hotline has been set up at NICD to field questions from from clinicians. South Africa has also developed and distributed clinical guidelines and case definitions to doctors and nurses in both the public and private sectors, which include information on how to diagnose and respond to a possible 2019 NCOV case. Provinces have activated outbreak response teams and are on high alert to detect and manage inadvertent cases that may arrive in the country. Screening of returning travelers from China at major airports have been intensified. I'll also go into a little bit of details in this regard, as this is, of course, an area of paramount concern. Our port health officials routinely conduct temperature screening for all international travelers. Those of you who have been traveling abroad could have noticed that we have a thermal screening, which is conducted at a distance, and that everyone actually coming through from international travel gets subjected to this routinely as they land at the OR Tambo and the other airports. However, due to the current risk of importation of inadvertent cases of the coronavirus from Wuhan City, our port health authorities have intensified surveillance of all travelers from Asia, especially in China. We should welcome Dr. Chirombo from WHO, as we indicated that they'll be joining us as well this morning. Port Health Services is responsible for preventing, protecting, providing a public health response to the international spread of the disease through the point of entry. Port Health Services are also provided in 36 points of entry with a staff complement of about 300 personnel. The service is provided on an ad hoc basis in the remaining smaller points of entry, and those are points of entry where people just local nearby entry points where one or two police would be there. There's very little movement of people. It's mostly villagers, and those are the ones we're talking about. But where there's proper high volumes, we're actually on the lookout on all of those. Screening is conducted in the port of entry to early detect an ill traveler by the following means. Temperature screening is conducted in 12 points of entry utilizing non-invasive thermometers, where all travelers arriving through these points of entries are channeled to the temperature screening. So this number is going to be increased in the next day or two so that it covers most of the other areas that I referred to. If a traveler is found to have an elevated temperature, they are assessed by a nurse, and if determined to be a suspect case, they are transported to the health facility for further management. The NICD is immediately notified. Arriving conveyancers, that is transport vehicles, health officials go on board each arriving international aircraft and ship to determine if there is any sick traveler. If traveler falls ill whilst on board, port health officials are informed by the crew members in line with the World Health Organization and International Civil Aviation Organization's requirements, and an assessment of the traveler is conducted upon arrival. If the traveler is found to exhibit symptoms consistent with the novel coronavirus, the traveler will be transported to a medical facility for further management. When contact information of travelers who may have been in contact with the ill travelers are collected and used to follow up if necessary. So if there are symptoms, we can deal with the patient and bring them in. And that's why we make the point that we have not got any research to suggest that an asymptomatic patient who's got no fever can in fact can be contagious. And that's the basis on which that whole system has been structured. As the busiest port in Africa, special measures have been introduced at OR Tambo, airport, where travelers on the direct aircraft from China in the past 14 days are required to complete a questionnaire for possible contact tracing. The National Institute of Communicable Diseases remains vigilant in monitoring the movement of this virus as reported by World Health Organization, and the team will take you through, as I said, through the Emergency Operations Center to show you how they do this. And I think it's important for the media to have a sense of all the steps that get taken there, so that when we talk about it, we have a sense that there's actually a very deep level of expertise and competence that sits behind the technology that detects the movement of the virus. An emergency committee meeting was convened on Wednesday. Firstly, we are working closely with the international community and particularly with the Chinese officials through the WHO. So there's ongoing, continuous contact with the Chinese officials. An emergency committee meeting was convened on Wednesday, 22nd January 2020 by the WHO Director General under International Health Regulations, IHR 2005. They concluded that although the development in China were concerning, it's still too early to declare public health emergency of international concern. There is a wide consensus internationally that there is no cause for panic, with experts pointing out that the common flu still remains an important disease burden. So just as a matter of comparison, the WHO still estimates that seasonal influenza, that's the usual flu, may result in 290,000 to 650,000 deaths each year due to respiratory disease alone. This perspective is important to maintain lest we get distracted and lose sight of the ongoing priorities. So some of the stuff that we used to, we kind of take for granted. In fact, is still a lot more problematic than the virus that has just erupted. Just because of the panic, I think it's important to always keep the sense of proportions in sight. We've received a number of queries regarding the safety and health security of our citizens living in China, particularly those in Wuhan City and Hubei Province. A meeting was convened by the Chinese Foreign Ministry with diplomatic mission on 27 January 2020. In summary, the government of the People of Republic of China has assured us and reassured us that there is no evidence to support the necessity to evacuate foreign nationals living in Wuhan City, and they have called for calm in this respect. All persons entering or leaving Wuhan are subjected to a 14-day quarantine to ensure that they do not develop symptoms. Foreign nationals who need medical assistance for whatever reason will be treated like Chinese citizens and be afforded all the medical care that is necessary in that area. Embassies are also enabled to support those locked out and locked inside Wuhan. And in our discussion with the Minister of International Cooperation, Dr. Naledi Pandor, she indicated that DIRCO is aware of at least 35 South Africans in Wuhan City, and they are in touch with the citizens who are there as well as the authorities, and therefore if there's any need to respond or to do anything, they will be in a position to judge that. At the moment, they believe that we just need to monitor that situation. I've asked the Ministry of International Relations to be here with us, but of course, as I've indicated, because of her travel, she's not around, but if there would be the other officials, they'll be able to share if there's anything new to be able to share at that level. DIRCO has been closely collaborating with all relevant stakeholders to respond appropriately to the needs of our citizens who either may want to go or exit or remain in China. It's important to understand that how we respond as a country must represent the best interest of the people who we intend to assist. In conclusion, I wish to then reiterate the basic principles to reduce the general risk of transmission of acute respiratory infections, which include avoiding close contact with those people who are suffering from acute respiratory infections, frequently hand washing, especially after direct contact with ill people or their environment. But frequent hand washing really is a basic precaution that all of us should be always familiar with. Avoiding unprotected contact with farm or wild animals if traveling in China. And when sneezing or coughing, it's better to cover your nose and mouth with a tissue or arm, and not your bare hands, but more kind of like that. In case of symptoms suggestive of respiratory illnesses, before, during, or after travel, the traveler must seek medical attention and share the travel history with their health care provider. So this, for us, constitutes the briefing for today. We will therefore be giving you regular updates, literally on a daily basis. We'll be issuing voice notes through radio stations to keep the public informed, but we'll also just make sure that you've got the right people who will be able to respond to your questions, who you can invite as media to do interviews, elaborate interviews, to discuss the subject in your studios and so on, so that on a regular basis we prefer that you get people who are our experts on this subject. Sometimes, to get the story out there, we sometimes may invite people who might create the sensation, and the public may not be able to detect the level of involvement of those individuals in the process of our surveillance and monitoring of the evolving outbreak out there. So we prefer that we have available to you those who are actual experts on the matter, so that they give us up-to-date information that is really linked with the operations of detection. That way, I think we'll be able to deal with this matter. We've seen that in the media, for one case that gets reported in one country, a whole sense gets to develop that, oh, maybe there's a lot of patients already teeming inside our borders who are affected by this virus. And we just want to assure South Africa that we are on very high alert, and in the way that we are dealing with the virus and the way we're monitoring the situation, it wouldn't be possible that someone could just slip under our fingers and then land up in South Africa and cause a kind of damage that we have been completely unaware of. That's why we made, again, I reiterate the point that the current clinical manifestation of the virus is such that for the virus to be contagious, it has to be coming from people who are exhibiting symptoms, amongst which symptoms is the issue of fever, and that's the easiest to detect, and as I've indicated. And with the alert on which we have South Africa, we will be able to pick up the virus or an infected patient at any one time. We are also open to to answering questions. As I was saying earlier, the Minister of Home Affairs was indicating, someone was asking him, he was discussing something unrelated, but they say, yeah, what about coronavirus? We should be on alert, but we shouldn't create an unnecessary panic. I also think we can't let our guards down. We therefore need to always keep our information balanced and factual, so that we can make sure that South Africans are properly informed about what situation we are in. At this point, therefore, let me hold it that and allow us to take the next briefing, and then we will be open for question after that. Thank you very much.
Thank you very much, Minister. I will ask Professor Cohen to please proceed with the NICD briefing on energies. Yes, MEC.
You want to show? You come sit here. You come sit here. Merci, please.
So thank you. I've been asked to give just a little bit more detail about South Africa's preparedness activities for a possible imported case of this virus. And I thought I'd just start off with a few words about what are coronaviruses and what is this virus. So coronaviruses are really a large family of viruses that are normally found in animals and in humans. And there are a small number, 4 coronaviruses that in fact cause normal respiratory disease in humans, like colds and flu. What can happen on rare occasions is that a coronavirus, which is normally found in animals, can undergo changes to its genetic material, which allows this virus to acquire the ability to infect humans and cause illness in humans, usually respiratory disease. And it appears that this is what has happened at this time. This type of event has happened in the past, and there have been two previous events of this. The first one is the Middle East Respiratory Syndrome coronavirus, which was reported from Saudi Arabia in 2012, and this virus, in fact, still circulates to a limited extent, mainly in the Middle East. And there was also the event of Severe Acute Respiratory Syndrome coronavirus, which emerged in China in 2002. And this Severe Acute Respiratory Syndrome coronavirus is, in fact, very closely related to and quite similar to this novel virus, which has been named the 2019 novel coronavirus. The international notification of this outbreak occurred in January 2020 when the World Health Organization released reports about clusters of patients with pneumonia in Wuhan City, Hubei province in China. These clusters of cases of pneumonia were all linked to a large market in China which sells seafood, poultry, and live wildlife. And very soon, very rapidly, the sequence and genome of this virus was released, and it was announced that these clusters of pneumonia were being caused by a novel coronavirus. Because of the close link to the seafood and animal market, it is assumed that this virus is of zoonotic or animal origin, although the exact source of the virus is not yet known. There are two really important components that South Africa needs in order to be really prepared to respond to a possible imported case. The first component is really to be able to rapidly identify any suspected case of novel coronavirus. And the second component is really that we need to ensure that South Africa has proper procedures in place to respond and contain a virus should a case be identified. And I'm just going to elaborate a little bit about some of the activities that have been ongoing. So firstly, as has been mentioned, the ports of entry are a very important place through which a patient infected with this virus could come. And there are a number of activities happening at the ports of entry. In particular, there is temperature screening involving non-invasive thermal screening devices. And there are very detailed procedures in place to manage any traveler who's found to have a fever and could potentially be infected with this virus. In addition, as has been mentioned, activities have been strengthened, particularly at the O.R. Tambo International Airport, which is our busiest airport. And these activities also have been particularly focused on flights coming from China. It is also possible that a case could develop symptoms after arriving in the country and then present to a facility to a healthcare facility for care. And to cater for this, guidelines have been widely distributed to clinicians throughout South Africa in both the public and the private sector with criteria for which patients they should worry about and what are the criteria for a suspected case. Now, these criteria include a number of elements, but the most important elements are firstly the clinical presentation of the patient, so what are the signs and symptoms, and the most important signs and symptoms are fever and cough. And the second important component to consider in whether a person is a suspected case is whether the person has a travel history to any of the areas where the virus is widely circulating, or whether the person has a history of close contact with a known infected case. Should a clinician identify any case about which they are concerned, we are offering a 24-hour hotline which is manned by medical doctors, and clinicians can phone this hotline and discuss the details of the case. And this hotline has received a large number of calls to date from concerned clinicians. However, there have been no suspected or confirmed cases identified in South Africa to date. If a suspected case is identified, a number of activities will occur. Firstly, the patient will be isolated rapidly to prevent onward spread of the infection. If the patient requires admission, they will be referred to a dedicated facility that has appropriate isolation facilities and also has intensive care infrastructure. If the patient is a mild case, then they will be isolated at home and given strict instructions about avoiding contact with others, using masks and other important interventions. The next important component is treatment of the patient, and there is no specific antiviral therapy currently recommended for this virus. Supportive treatment is recommended, and this involves aspects such as provision of oxygen and respiratory support should it be needed. We have established an expert clinical group which is led by an infectious disease specialist, and this group is really mandated to actively scan all of the emerging information about the best possible treatments for patients with this virus and then update the clinical guidance as information becomes available. The next important component is to be able to rapidly make the diagnosis, and guidelines have been widely circulated to clinicians so that they know exactly what specimens to take and where to send them. There are dedicated transport systems that have been set up to make sure that all samples can rapidly reach the laboratory at the National Institute for Communicable Diseases of the National Health Laboratory Service. And our laboratory is offering a 24-hour service manned by technologists and scientists to be able to rapidly diagnose the virus. And the last important component of managing any suspected case is contact tracing. So as soon as a suspected case is identified, then there will be immediate activities to identify all the possible contacts of that case in real time and start active contact tracing and monitoring of these individuals. And these contacts will be monitored for 14 days to see whether they develop any signs and symptoms. A dedicated team of epidemiologists has established databases and protocols for tracking the progress of clinical queries, laboratory testing and results, and ensuring that follow-up of contacts is thorough and complete. The National Department of Health has convened an intersectorial meeting to bring together all partners in the response. South Africa has an emergency operations center, which you'll be able to visit a little later, and this is housed, in fact, in this building. An emergency operations center is designed to coordinate responses to complex health risks and brings together all partners under a single integrated management structure. The EOC, or Emergency Operations Center framework, ensures that adequate resources are made available rapidly, and there is good coordination of different aspects of the response. The EOC is currently in alert mode, which means that a team of relevant partners has been assembled and are working at strengthening and implementing response procedures. Daily meetings are held to ensure coordination. The activation of the EOC is normally done through an instruction from the Director General of Health. South Africa is actively monitoring the global situation with regard to the coronavirus in real time. We have dedicated staff who use specialized software to scan both official reports and the media 24 hours a day and collate these for review daily or more frequently as needed. Our guidance and activities are updated frequently in response to global events as needed. South Africa is prepared to respond to the novel coronavirus. The response is a collaborative effort involving many partners, including the National Department of Health, the National Institute for Communicable Diseases, the National Health Laboratory Service, the private sector, and several other government departments.
Thank you. Thank you very much, Dr. Cohen, for that comprehensive, and Minister would like to make some remarks.
Yeah, thank you. I think you have heard quite an elaborate explanation of how the center is. There's 2 points to raise. One is that the Emergency Operations Center is on high alert. There's a technical description of the stage at which we are. It's the highest you can ever be at if you're dealing with the kind of reports that we are facing right now. But if we have to put it on a full swing, full operation, you actually need an activation by the Director General of Health. And that would happen under 2 circumstances. The first is if there's a case detected in the country and confirmed, and therefore we then have a full operation of this center. The second one is if WHO declares an instance of what you call public health emergency of international concern, That means every country must stand up and now be on a daily operative alert where we are now basically in full swing, as it were. So those two instances haven't arisen. So the highest level of preparation we can be at is what has been described. So if you don't see anything or you don't hear anything from out there, it's not because, we're not watching what the situation is. We're basically saying we're at the highest level under the circumstances to be able to detect and act and respond. The second issue is that there are already hospitals that have been designated. Charlotte Maclege, Tembisa Hospital, and I think Steve Bigo are the ones that are targeted. We're going to ensure that even level of information is intensified right to the lowest level so that every professional and every staff is alert of what needs to be detected in case there could be anything that's happening there. But that is the level of our preparedness at this point. Maybe my colleague would just want to add a word or two.
Thank you very much, Minister. No, I just want to clarify one fact, because as the Minister Mkhize has already said, last week during the press conference at Dipsliot, I was asked to comment about coronavirus. And when I declined, it was as if I'm funny. But from there, we've been inundated with calls about what is the Department of Home Affairs, what guidelines are they giving, what statements are they giving, what instruction or information were given to travelers. I want to state that at our major ports of entry, we do have port health. We've got, whether there's an outbreak or not, it's always there. There are port health officials at our ports of entry, whether it's land ports of entry or airport or seaports. We have got officials from the Department of Environmental Affairs. We have got officials from agriculture. They're always there. They man their ports of entry. So anything that is to do with health, we defer to the Department of Health. We don't deal with it as Home Affairs. So I want to announce that the Department of Home Affairs won't be releasing any statements about this. If there's any information we want to give, we'll give it through health. You can imagine if health issues statements to you, Home Affairs issues, telco issues, you're going to get confused. You'll no longer know what is fake news or what are the correct news. So we'll issue, if there's any information which we think as Home Affairs needs to be known, the Minister will be told and he'll convey it to you. This outbreak response team has got officials from Home Affairs here who will sit here in the response team. And whatever decision is taken will be taken through there. So please tell the public they must not be making any inquiries from Home Affairs, won't be issuing any directive, won't be issuing any statements, unless the Minister asks us specifically to clarify something. Thank you very much.
So that's it. We could be looking at the questions, but our main focus is what we have indicated as MINORT. This interdepartmental team sits on a regular basis. That's where all departments are able to consolidate information. If it relates to what's going on all over the world, DERCO will announce and will be issuing statements. If it's about health preparedness for dealing with the virus inside the country, health will announce that. As I've said, daily updates are going to be available. Please don't forget to ask for the contact details. It would also be nice to, at some point, get WHO to make a quick comment.
Minister.
Yes, if you could just come closer and just make a quick comment, and then we can let the discussion. You can see. I'm sitting.
Good morning. Thank you, Minister. I think I'll just make a few remarks to add. I think most of the issues have been addressed by the Minister and NICD. I'll just make a few points and highlight a few of them. I think the first one is just to emphasize that we as the World Health Organization at the three levels, so that's the office here in South Africa, at the regional level and at the global level, are working with the government of South Africa to support and also other partners to support preparedness for this epidemic, taking into account the epidemic that is happening. Secondly, I want to highlight that it's very critical that for us to be able to address and deal with this outbreak, we will all need to work together to be able to stay ahead of the epidemic. And that means, as the Minister has already said, all the sectors, all the ministries, private sector, partners, and the press. And it is likely that we will see more cases from, especially from Wuhan. As you may know, most of the cases have happened in China. We do have 56 cases. I'll just highlight the latest figures that we have. As the Minister has already said, the numbers are changing quite quickly, but as of last night, the briefing that WHO has submitted based on the reported cases, 4,593 cases have been reported confirmed globally. Of those, almost all of them, which is 4,537, are in China. There have been 106 deaths that have been reported. Outside of China, there have been 56 cases, which have happened in 14 countries. So it is likely that these cases may continue to increase, and as I have mentioned, most of the cases are happening and coming from China. The WHO General of the World Health Organization, Dr. Tedros, is currently in China. As the Minister has already mentioned, we are working very closely with the government of China and other governments. So we are working closely, and our Director General is actually in China at the moment. Whilst WHO does not recommend restrictions on travel and trade, these are matters, and I wanted to just highlight that those decisions will be taken by national governments, but WHO does not recommend travel and trade restrictions. The Minister has already described what is being done to ensure, and that is largely in line with what WHO recommends. So obviously many people will be worried in South Africa and other countries, and the Minister and NICD has given the guidance, and we are supporting and continue to work with government in supporting the preparedness. And WHO, working with South Africa and other countries, continues to encourage all countries to continue preparedness, collecting information. We as WHO will continue to offer the latest evidence, the latest information, and we'll continue providing information to all governments and working with them as we are doing in South Africa to support the response. So thank you very much, Minister. Thank you, colleagues.
Thank you very much, Dr. Ryan Chirombo from the World Health Organization. Minister, may we proceed to the Q&A?
Yes, thank you.
Thank you very much. We'll take rounds of 5 questions. If please you could rise and state your name and the publication you're from. And you'll please forgive us, we will be very strict about the nature of the questions. We will only be addressing questions relating to coronavirus. Yes, ma'am, I've got you. I think we will have time for 2 rounds before we have to wrap. So there was a first hand, 1, 2, 3, 4, 5. You will be first in the second round. Thank you.
Hello.
If you may please rise.
My name is Li Yongyan, and I'm from Chinese media People's Daily. And my question is, it's fortunate that there has been no infected cases in South Africa. But does South Africa have a designated hospital to receive patients once they are found to be infected? And can you release the specific information of the hospital? And just as you said that we have the hotline, so what's the number of the emergency hotline? Can you give us some details? Thank you very much.
Greetings, it's Angelo Coppola from China Global Television. I guess it's a question for Professor Cohen. You talked about clinicians being informed about what they need to be looking for. What about the chemists and the pharmacists? Are they being informed as well?
Nia from Eyewitness News. I just want to know if someone can elaborate a little bit more on the suspected case in Zambia, and then also if a team of South Africans is in contact with those 35 South Africans still in Wuhan.
Thank you. Next question is okay.
Hi, good morning. It's Kyle Kumalo here from ENCA. Minister, you say we are adequately equipped to deal with this virus. I just want to know, like for example, in as far as the land ports of entries are concerned, especially in some areas in South Africa where you have porous, centers where people can easily walk in. What about those areas? Are you sure that you're monitoring those areas so that we try and deal with this? But also, there has been reports that Ethiopian authorities have asked South Africa to look at the samples. Are you aware of that case from Bole International Airport? Thank you.
Over here. She's going to be first.
So what airport? What?
Minister from High FM News. I'd just like to know, before the announcement of the coronavirus, what about the South Africans who've traveled back home? Will those people perhaps, will they be going back to those who traveled before the announcement back home and testing for those people for the virus?
Thank you. We go back to this draft. The responses.
Thank you. The hospitals that have been prepared to receive patients, I'm sure you missed them. I gave the names just now. Charlotte Maxeke is one of those, Tembisa Hospital, and I said also Steve Biko Hospital. Those are the hospitals designated to receive patients if there should be any challenge at that level. And we have here the MEC for Gauteng, who is the province that will be activating those centers. We are intensifying the information to all the staff at different levels so that we have full awareness of everyone in the area. But those special areas are always ready because they are actually specifically prepared for isolation, for barrier nursing, for infection control, and for ensuring that people who are there are well trained to be able to manage patients without themselves getting infected or avoiding cross-infections until the case management results in complete healing and discharge of the patient. So those have been taken care of. The issue of the hotline, I'm sure someone's going to give that to you. I'll skip the question about the chemists and pharmacists because it was directed. Our NICD team is working very closely with the authorities in Zambia and the clinicians and researchers so that we are always in contact with the situation in Zambia. As I was giving an indication around the instances of Ebola virus, from here we are able to detect everything that's happening in the continent. As soon as there's something reported, we happen to pick that up fairly quickly. I think we must also note that South Africa does harbor advanced facilities for management, detection, confirmation of some of the viruses that are identified in some of the areas. So it does actually happen that in some instances we would get involved, but also we always in touch with all those who are managing those particular cases. In this case, for us, we will actually know as soon as there's any new developments with regard to this case, and we'll make that public. The South Africans who are in Wuhan, I did actually specifically say that the minister has indicated that they are in touch with the citizens in Wuhan and the authorities in Wuhan, in Hubei province, as well as the Chinese authorities on these particular instances. We have also said that WHO has not recommended evacuation, and Chinese authorities have also indicated that they are confident of their management of the situation on those particular individuals, including the Chinese citizens. And so if there's anything, any change, any new development that require our attention, we will be informed by the Chinese authorities, but DERCO is also in touch directly with some of those. And in that process, that means that anything that needs to happen with those individuals, we will have first-hand information. Again, we'd like to assure you that at that level, we'll be able to deal with the situation should there be any need for additional activities or precautions in that regard. The issue of the porous borders, well, let me say, we have taken care of the ports of entry where the majority of the people come from. When we talk about porous borders, we basically are talking about instances where between a South African village and a village in the neighboring country, whether it's Eswatini, Mozambique, Zimbabwe, Botswana, where there's basically a line or maybe a river or maybe just a hill or, that's where people move across. And this happens because of the history of our country. People basically, there are areas where they move between the two parts, the two countries with ease. And on those instances, we anticipate that when people have got symptoms, they'll report to the nearby facility. And when we say we're on an alert, we are saying that if anyone is suspected by any of our institutions, our clinics, or our hospitals to be having something that is suspicious, they'll then detect them and then send them over to us. The alert is more about saying that from anywhere where there's a suspicion, that's where things start. There has to be symptoms, and there has to be suspicion from the individual who will then seek assistance when they get to our clinics and our hospitals, and we suspect, then of course we take them up through the system. That's the best we can do under the circumstances, but we do not believe that we must suddenly suspect coronavirus in every village where people might be crossing into the country. But we must say that if there should be significant enough symptoms that will warrant someone requiring assistance, then the system will be able to detect that. So again, we would like to assure us at that kind of level. The area of there are people who travel from China before the announcement. Well, it's more than 10 days now. It's more than 14 days. We expect that they should have shown the symptoms already. And so I think just by time estimation, we can exclude a risk from that group, that they would have actually already showed up somewhere if they were affected by the time they landed in our borders. So that basically means that those who might have landed back to South Africa before there was an announcement, if they have not shown any symptoms, they are less likely to be risky for us. But we are, however, saying that our system is such that if we suddenly pick up someone who rocks up with a temperature and suspicious symptoms, those are the ones we're going to take up and filter. We must also say that we actually detect and screen a lot of people whom we don't announce to the public, just to make sure that we don't have any of the suspicious problems. Even with the days of Ebola, if you landed up with a fever we don't understand, we take you up and put you in isolation, we screen you. I sit here and get informed to say, listen, we've got someone who's got a very suspicious fever, we're going through the screening test and so on, and before the night is over, the confirmation comes, no, it's not Ebola. It's not a hemorrhagic contagious fever of any form, and therefore we've taken them through a normal system. So we would actually get the whole situation, the system is rolling It's only when we're confirmed that we will actually announce. When we have suspicions, a high index of suspicion is our surveillance tool. Don't take for granted. If you suspect, refer. When you refer, we test. When we test, we confirm. Once we confirm, we deal with the individual. Then once we suspect and we have got indication that this might be, then we start isolating and we have a thorough test to confirm that. This whole team is about that. And you can imagine all of us are very keen to actually find that one. And we therefore look around for those. So it's not likely that someone who came from China will suddenly rock up today and say, I was in China 2 months ago, I think I've got a coronavirus. It's unlikely that we'll have that. But because it has taken so many days, it's unlikely that, scientifically speaking, that you can actually end up with a problem. That's why I keep making the point that you are also unlikely to have a contagious and infectious individual who has not exhibited symptoms. And if you have not exhibited symptoms, and that would have required you to seek clinical assistance, then you are not likely to be our risk. So suddenly someone might feel, hey, maybe I also have. We'll look at you, and if you don't have the symptoms, we will need to assure you. So the panic that you've got outside South Africa, it's natural that South Africans will also say, hey, maybe we're also having a problem. But once you know how we go about it, it's so rigorous and scientific that it's actually very, very minimal chances that you can actually get anybody to be a risk to South Africans, and we have not picked that up. The chances are we'll pick you up before you are a risk to anyone else. And that's really what we'd like to convey as our reassurance to you. I think there's a question specifically.
Can I say something about the porous borders?
Okay.
Because, yes, thank you very much. You may remember that we were inundated with this question during the outbreak of Ebola. In fact, there are people who demanded that we must send police and the army to line up at the borders and seal them and not let anybody come in. We do not have porous ports of entry. We do have porous borders. But what you are mentioning is a very, very remote theoretical possibility. At the moment, the figures mentioned by the World Organization people are all in China. Can you imagine somebody moving from China, I don't know, flying to what country and walking through a porous border in South Africa? That possibility is very, very remote. It's not going to happen. Even if the disease was around here, and that's why we answered that question during Ebola. Nobody is going to be sealing borders. I don't think even countries neighboring China will start lining up the army and the police to seal the border like that. Much as theoretically is possible, it's very, very improbable, it's very, very remote. We're not going to be sealing borders, and I don't think that really should worry people. At any rate, if you remember how we answered this question was answered during Ebola, most of these people will be very sick, will be infective. They are not going to be walking through borders. It's a very difficult job to walk through a border for so many kilometers from China. So let's not make people panic about that. Thank you.
So thank you. With regard to the question about pharmacists, I think that's very important. Our guidance has really been distributed very widely to all levels of healthcare workers. And in fact, we do receive a number of queries from pharmacists who are often on the front line for these cases of fever. So I do think one of the advantages of the high media interest in this virus is that really there are very few people in South Africa, I think, who aren't aware of this virus. And so there is a very high level of awareness through all healthcare workers, which I think is a very good thing, because what we want is for healthcare workers to reach out to us so that we know of any suspected cases. I just also, there were questions about samples coming to South Africa. I just wanted to confirm that the laboratory here at the NICD of the NHLS has been requested by the World Health Organization and the Africa CDC to act as a reference laboratory for Africa, and we've agreed to fulfill this role. So we've already had requests from a number of different countries. Should they have a case, will we be able to assist both with testing and also with helping those laboratories in Africa to get up and running with doing testing in country. And so we are fulfilling that role as well.
So that basically just means that the chances are any case that is confirmed on the major part of the continent will also have the information about it. Let me repeat this so that until the three ladies and gentlemen are ready for it. We're saying because most of the testing will also be referred to South Africa, irrespective of where the cases might be detected, we are very much likely to be aware of that information about the cases there, probably even before that country can confirm they've got it. It will be us who will be having a chance to confirm it. And we're just saying that because, we're just trying to give as much information about it. But if you tell the story out there, the story is generally told through exceptions. What doesn't happen, what may go wrong, as it were. And this is the nature of the questions that we're trying to address.
Thank you, Mr. So we will take the next round of 5 questions. Colleague, I do recognize that you wanted to ask a follow-up question. We will see if we can get the follow-up question squeezed in afterwards. So we have 1, 2, 3, and 4. Okay, we'll start this side.
Good morning, I'm Consultant from SABC Television News. Just a few questions. Minister, you said that the Emergency Operations Centre is on high alert. If I heard correctly, the World Health Organization is saying that there are 14 other countries affected outside of China. So I understand that screening has been intensified, in particular at big airports like Rotterdam International Airport. But at what point do you decide as the South African government to limit some of the aircrafts coming in from Asia? I know that Hong Kong, for example, is limiting aircraft coming in from mainland China. So at what point will South Africa consider that? Also, would you consider evacuating South Africans who need to be evacuated there? Despite what you just said, Minister, you're in contact with the Chinese authorities. There's no need at this stage for foreign nationals to leave, but would you be willing as South Africa to evacuate some of the South Africans that we spoke to over the past couple of hours who are returning to China for work? We have a number of South Africans working there as teachers and everything else. But would you be considering, evacuating them, and at what instance? Lastly, Minister, you mentioned Charlotte Macquarie Hospital and Tembisa Hospital as hospitals that would be able to assist should South Africa become affected. How? Because Tembisa, for example, and the Gauteng Health NEC would attest to this. Just a couple of hours ago, or a couple of days ago, the Tembisa Hospital was saying it does not have the staffing capability. It does not have, enough beds to take care of patients that are there to deal with here in South Africa. How do you plan to do this, where Tembisa Hospital, for example, is struggling with staffing issues at the moment? Thank you.
Hi, my name is Catherine Child. I'm writing for Financial Mail. Just for clarity, there's a lot of fear about this because people can die. The people who died in China, they are older and sick, am I correct? They're not a normal, so if I had to get the virus and I'm healthy, I'm unlikely to die of it. So it's people who, the kind of people who die of flu. Could you just confirm that?
I didn't get the question.
To summarize that question, I think what we're trying to ask is who are most at risk of death?
Hello again from People's Daily, Chinese media. We know that China has experienced many battles against diseases such as SARS in many years ago. So please give some comments on China's performance in the battle against the disease this time. In the organization or the governments. The governments. Thank you very much.
Good morning, my name is Arisa. I'm here from Media 24. Minister, you said that the 3 hospitals are here in Gauteng. I just want to know, why are the hospitals only in Gauteng, and are there any other hospitals in the rest of the country that will be able to deal with this disease?
Thank you very much. Before I give opportunity for Minister and Ministers to answer, this is the last opportunity for one more question, otherwise we will wrap it at this point with the question and answer session. No? Okay. Thank you. We will proceed to answer the questions.
You don't want to do that? Okay. Oh, I see. Okay. I see. Now we're getting trained on technology here. With regard to the Ethiopian case, the CAO here has actually confirmed that they are expecting the samples from Ethiopia, so that will be possibly arriving sometime today, so they'll be dealing with it. So that completes that question. The last question is about why are these only in Gauteng. We're just giving an example in Gauteng simply because we are in Gauteng, and we are also talking about OR Tambo, which is really where the major thrust of the patients would be coming from. So the different provinces, mainly the provinces that have got big airports where we expect movement, will be KZN through King Shaka. There are actually hospitals there that are ready, and then of course same with Cape Town, that would be ready for that. The question is about challenges in the various hospitals that we have spoken about, that they've got challenges of staff and they've got challenges of equipment and so on. It is true. Most of the hospitals will report those problems, but to get the isolation is a very small unit that has got specialized trained nurses and facilities for barrier nursing to seal up those cases. That's what you will have. It doesn't refer, when we have a case, one case that will be needing attention, there are facilities which are available there, but doesn't mean that we have got the entire hospital now open to be treating hundreds of cases who are having coronavirus infection. So sometimes we conflate issues that are not necessarily related. Yes, there are challenges in Tembisa Hospital, Charlotte Maclegay, and other hospitals. Staffing issues are generic. There are problems in most of the hospitals. We're dealing with that. Issues of infrastructure, we're dealing with that in most of the hospitals. It's day-to-day issues that we have to acknowledge are a challenge. But the isolation units are very specific, niches inside a particular a hospital. That's really what we're referring to. It's a capability that you will have to develop even if you have a shortage of staff. You must actually provide for that because it's a notifiable disease, it's a highly contagious disease, it's a kind of disease that will you need to contain so that it doesn't affect the rest of the country. So I think that's how we must understand it. So if you go to any of the hospitals and ask them, guys, are you ready to receive this patient and that patient and so on? People will say, but look at this queue, look at the challenges. That's not how it works. These problems are going to be there, but when we deal with the specific isolation, then we have a specific targeted area where we actually have to deal with it. So I think we need to understand it in that kind of context. The question I have answered the question about South African citizens in Wuhan. I'm actually going to be dealing for the third time. We have said that DERCO is in touch with all those citizens. DERCO is in touch with the authorities in China. There has not been a recommendation for evacuation, and there's no decision to evacuate. And so we would like to keep it at that. We will be obviously advised. If Chinese authorities suggest that something should be done, we will deal with it on that basis. if the WHO suggests that something needs to be done, we'll deal with it like that. I think that the South Africans out in Wuhan and other areas are very much likely to be agitated and worried. The relatives in South Africa are very much likely to be worried and concerned. All we're saying is that we are comfortable with the reassurance we're getting from the Chinese authorities on this matter. Someone asked a question about Chinese capabilities of being able to handle this matter. Well, they're already handling 4,500 cases, and no other part in the world is handling that. And they are the ones who are deciding. At one point, they've decided to quarantine people. They've decided to seal up some of the places. We think that they are on the right track. We think that because of what they are seeing and their clinical expertise, are able to guide them in terms of what interventions are needed. There is no reason for us to panic on behalf of people who are in China. And I think that we must indicate that South Africa won't make outrageous statements about what needs to be done unless we actually find that those who are handling the matter are actually requesting us to do so. So that's the kind of collaboration we have with the Chinese government. And you have heard WHO is similarly saying the same thing. Indeed, the WHO has not also recommended any drastic evacuations, as it were. So I think we're still within a normal response with that. I think we shouldn't worry too much at that level. Limiting aircrafts from China, it falls on the same kind of categories. And if there is no basis for us from limiting, I think we can't point out to you the basis on which we should actually act drastically. Maybe those countries that have done have got specific reasons that they can cite. And as we find that there are new reasons to worry, we will then deal with it, in that way. So again, I think we don't want to get into speculating about what can or what might be done in other countries. I think we must deal with it on the basis that up to now the evidence that is ahead of us is showing us what we should be doing, and we want to keep it. Like that. Largely, people who have died of this, and this is a general problem. Most of the viral infections tend to attack people with low immunity, the elderly, the sick, those who are under cytotoxic treatment, and those who are having other invasive conditions, neoplasms, etc. So they would tend to be some predisposing factors. Generally, these viruses are available all over. You breathe them in and out, and they don't cause you problems. And one day they turn on you simply because your immunity is lower. So low immunity does become a risk for various reasons. We are not saying that's the only basis. We're simply saying that it does appear that they tend to be what we call opportunistic. So they tend to exacerbate ill health in people who already have other bases on which their immune system is compromised. So that tends to be the situation. But you can't say, look, you can take a chance, go there and get exposed because your immunity is fine. So we're just saying there is that kind of relationship insofar as these situations are concerned. I think your question about SARS and China, certainly I think we've dealt with that to say that China is handling 4,500 cases. Right now, no other country in the world is doing so. They've taken huge drastic actions to limit movement, to build facilities, to expose people to treatment. We are going to continue to monitor how things are developing, but there's no reason or basis for us to want to go and intervene in China or to go and act on people who are in China because of our concerns about China's capability. We don't have that as an issue. So largely, I think from where we sit, I think the interest of the media in this matter is quite appropriate. It is something that's really causing a lot of concern. And so feel free to raise these issues because a lot of the issues you raise, we're also picking them up on people as they are debating. So you will find that people are going to be asking these questions, and we need to also go back and look for answers. And we want to just commit to be open to media, so that if you've got concerns, you've got questions, just come over, let's deal with them so that we can keep the conversation going. I think our plea is that let's keep the conversation going based on facts, based on realistic issues, so that we can then guide people largely to say, how do we go about it? The issue of the operation center, as we have indicated, the basis on which we will activate it at a higher level is when we've got an instruction from WHO declaring a matter of public health emergency of international concern. If that gets declared, we're going to have to activate this to the next level. But secondly, if we detect a case in South Africa, not suspect, but confirm. And that's when we're going to be able to deal with it. And I think the point that we're making about also having a reference laboratory in South Africa gives us additional advantage of being able to monitor the development of this disease in the Africa region. That means that we are in a position to know for a fact that there is a confirmed case in this particular country, and of course we will be still in touch with the authorities at that level. But the network of the scientists, the clinicians, and the researchers and in the whole continent is very tight. It is such that it's one area that is most capable of detecting things that are happening in different parts of the world, of the continent. And so, again, I think from where we sit, we would like to just reassure that it's unlikely that something will arise and we're not aware. We'll pick it up and then we'll indicate. And when we do pick up and confirm any case, we will actually be public in confirming it to the public. So again, if you suspect or you hear that you think there's a case in such and such a place, just pass us the information. We'll actually send people there to go and detect it and see what's happening, so that nothing falls into the cracks. And we also assume that when the media picks up something, it's also another way that we'll be able to find out things that we might have missed, and therefore we'll make sure that we seal our network of monitoring and detection. Thank you very much.
Thank you very much to the Minister, thank you, Mr. Zweli, and to the rest of the delegation. We'll now give an opportunity for the delegation to visit the EOC Center. Then maybe we may be able to ask some of you to join us, and maybe we'll actually be between myself and my colleague Bobo Maja up to the EOC. Thank you all very much for being with us together to close this session.
Thank you. Presentation.
Mr. Minister, hi, pretty weak. Can I give that to you when you have time?